Welcome all. Today we will be seeing a topic about varicose vein. So it is an important essay question. The topics we'll cover in this video is the definition, risk factors, site, classification, pathogenesis, etiology, clinical features, complications, investigations, differential diagnosis and treatment. So first coming to the definition. Definition is it is permanently elongated dilated veins with tortuous path causing pathological circulation. So there is elongation of veins that causes pathological circulation, and there is reversal of blood flow through the faulty valves. The valves are incompetent and causes reversal of blood flow. So next one is the risk factors. It is more common in female sex and due to the occupation that demands prolonged standing. And next one is the immobility. Persons who are immobilizing the limb for a long period of time, varicose vein chances of getting varicose vein are more. And there is next is intra-abdominal pressure is increased in cases of tight dresses, wearing tight dresses, or in case of pregnancy, intra-abdominal pressure is increased and it may cause varicose vein. So next one is the increased progesterone level and high heels. So these some of the risk factors: female sex, occupation that demands prolonged standing, immobility of limb for many hours, increased intra-abdominal pressure due to pregnancy or tight dresses, increased progesterone and high heels. So next is the site. The site is the common sites is lower limb, papilliform plexus, vulva, perineum, and sites where there is portosystemic anastomosis. So these are the four things, that is lower limb, papilliform plexus, sites where there are portosystemic anastomosis, vulva and the perineum. Next, coming to the classification. There are three types of classification. The first one is SEEP classification. SEEP classification is expanded as clinical signs, etiological classification, anatomical distribution, pathophysiological dysfunction. So first one is clinical signs. It is graded on different grades depending upon the classification. Based on etiological classification, it is classified as congenital, that maybe it is present from the birth, or it is primary or secondary to some diseases. And the fourth one is there is no venous etiology, there is no venous relation to for the causation of varicose vein. So next one is the anatomical distribution, maybe either superficial, deep or not identified. So pathophysiological dysfunction includes reflex, obstructive, both or not identified. So next type of classification is depending upon the veins. Second type of classification is depending upon the veins. It may be great saphenous vein varicosity, short saphenous vein varicosity, varicose vein due to perforated incompetence. So next one is third type of classification is thread veins, reticular varices, varicose veins, combination of any of the above. Depending upon the diameter of the veins, this is classified as thread veins, reticular varices, varicose veins, and combination of any of the above. So there are three classifications. First one is the SEEP classification, next one is depending upon the veins involved, and third one is the depending upon the nature of the vein involved. That is thread veins, reticular varices, varicose veins, combination of any of the above. Next, coming to pathogenesis. Coming to pathogenesis, there are two theories. The first one is fibrin cuff theory, next one is white cell trapping theory. First one is fibrin cuff theory, next one is white cell trapping theory. So first one is fibrin cuff theory. Generally in varicose vein, venous valves are incompetent. So due to the incompetency of the venous valves, there is stasis of blood. Due to the stagnation of blood, chronic venous hypertension occurs, and this causes defective microcirculation. And due to the stasis of blood and chronic venous hypertension, RBC diffuses into the tissue planes, that is RBC diffuses into the cells. As soon as it enters the tissues, there is lysis of RBC and release of hemosiderin pigment. Due to the release of hemosiderin pigment, there is pigmentation and it causes dermatitis. As a result of all these processes, the capillary endothelium is damaged. If the capillary endothelium is damaged, there is no diffusion or exchange of nutrients. So the cells will not receive oxygen, nutrients or any of the components required for the cell. So there is severe anoxia and this causes chronic venous ulceration. So next one is the white cell theory. In white cell theory, due to the stasis of blood, the leukocytes are trapped and these leukocytes are inappropriately activated, that leads to the release of proteolytic enzymes. These proteolytic enzymes causes cell destruction and it further leads to ulceration. So these are the two theories, that is fibrin cuff theory and white cell theory. Next, coming to the etiology, varicosities are more common in the lower limbs because of erect posture, and the long column of blood should be supported by valves, and due to the long column of blood, there is weakness and incompetency of the valves. So there are two types of varicosities. Primary varicosities is due to congenital incompetence or absence of valves. If the valves are incompetent congenitally from birth, or if the valves are absent from birth, that is a reason for primary varicosity. Or weakness of wasting of the muscles. Weakness of wasting in the calf muscles is the main reason. And defective connective tissue and smooth muscle in the venous wall is also a reason for primary varicosities. And next one is the inheritance. Family inheritance of a gene that causes primary varicosities. Next one is the secondary varicosities. Secondary varicosities may be due to many reasons. Some of the above is mentioned here. Secondary varicosities may be due to many reasons. Some of them are recurrent thrombophlebitis, occupational, obstruction to the venous return, pregnancy, arteriovenous malformations. Next, coming to the clinical features. Five main clinical features are included here. First one is the dragging pain and postural discomfort. Next, due to the stasis of blood, there will be heaviness of legs and nighttime cramps, especially midnight, and edema is felt with itching, discoloration, ulceration of the feet, and the patient seems painful to walk. Next is some of the tests are mentioned here. The first one is Safina-Varix, Brody-Trendelenburg test, Perthes test, modified Perthes test, and 3-tourniquet test. So coming to complications. The complications include hemorrhage, periostitis, pigmentation, venous ulcer, Marjolin's ulcer, lipodermatosclerosis, and deep vein thrombosis. Coming to investigations and differential diagnosis. Investigations include venous Doppler, duplex scan, plethysmography, ambulatory venous pressure, arm-foot venous pressure, and varicography. And differential diagnosis include lymphedema, atriovenous malformations, renal and cardiac diseases, hepatic diseases, vasculitis, chronic infections like tuberculosis and syphilis. So these are the differential diagnosis and investigations. Treatment include conservative treatment and surgical treatment. Conservative treatment is elastic grip bandage application and elevation of the limbs, Unna boots, and a pneumatic compression method. So these are the conservative treatment. Surgical treatment include Trendelenburg operation, stripping of the vein, substitution of short saphenous vein, Linton's vertical approach. So these are the surgical treatment. So first we've seen about the definition, risk factors, sites where it is more common, and then about the three types of classification. Sieve classification depending upon the vein, three types of classification, and depending upon the diameter of the vein. Pathogenesis, two theories, fibrin cuff theory and white cell trapping theory. And next one is the etiology of primary varicosities and secondary varicosities. Clinical features, five main clinical feature, and 5 tests, that is Safina-Varix test, Brody-Trendelenburg test, Perthes test, modified Perthes test, 3-tourniquet test. Complications, hemorrhage, periostitis, pigmentation, venous ulcer, Marjolin's ulcer, deep vein thrombosis. And next one is the investigations, differential diagnosis, conservative treatment, and surgical treatment. So this is